Hello all, very good morning. In today's topic, we'll discuss the management information system. This is from the 4th unit of community health nursing from 4th year. So here we are mainly discussing the roles and responsibilities of community health nursing personnel in various aspects. So I have discussed the previous topics also. You can check out my channel. And now I'm going to discuss the management information system. So coming to this management information system. So if you see this management information system, it came into existence, means it began to play an important role from the year 1970s. So this was mainly used to provide efficient as well as effective patient care. So mainly it was applied in the field of public health. So coming to the definition here, it is an organized system that manages the flow of information in the proper time frame and thus means nothing but here the information is organized in a proper manner. So whenever you see any kind of information or any kind of data which is there in this MIS, you can clearly identify the part which you want. Means everything here is organized and it was arranged in a great manner, so that whenever you see it, you will have an exact idea regarding the matter which you are observing. So it is this management information system, it is mainly means it is extending its help in the planning as well as controlling and operating the health agency. So here you can see the data which is collected from the community or the public health field. It was entered in the form of records and reports and in different means. So in this management information system, what they are doing is they are embedding every information that is collected from the field. It may be a patient information, or it may be a community information, or it may be a personal information, or it may be information regarding a particular disease or particular community with a particular problem, health issues. So whenever you want any kind of data for planning, so what is the population, how many people are affecting, what is the age group, so everything, the data which is collected from the field, it is embedded in this management of information system. So it is mainly used to provide efficient and effective patient care in the field of public health. So what is the purpose here? So the purpose of this information systems in community health is it is mainly useful for eliciting the more information for deciding upon the quantity, quality and cost effectiveness of healthcare services. So the data which is taken, it is helping us to provide, so how much quantity need to be given and what is the quality that has to be maintained. So the quantity based on the number that is required, and quality means how many health personnel are there, whether the needs of the community or needs of the particular patient is meeting or not, and what is the cost effectiveness. So how much budget can be kept there. So in order to do those things, you need to have some data, and this data is mainly taken from this management information systems, and it is also helping in quick reimbursement from third party payers. Means when you have proper information and you have the data, so for in this management information system, they're giving us, so what is the cost effectiveness, so how much amount will be there for the particular health issue, what is the amount for the particular surgery, or what is the amount for the particular procedure. So whenever you have proper information, the third party payers, means the insurance companies or some other health agencies, they can pay the money very easily. So it helps in quick reimbursement from the third party payers, and actually it helps to satisfy requirements of central as well as state legislation. Nothing but, so in order to do any kind of health program, or in order to provide any kind of health benefit to a particular community or a person or an individual, the state government, it requires some information, as well as the central government, it requires an information. So what is that information? So based on the information they are getting, so they can come to a decision making, means they can come to an end that an area is affected with so and so disease and it has to be taken into consideration, and these are the measures that can be taken place in order to prevent those. So mainly whenever they want to do any kind of, or whenever they want to implement any kind of programs, here the central and state legislation, they are getting the information from this information system in community health nursing. And nextly, It helps to plan, control and organize information. So whatever the information you are getting from the field, or whatever the information that you are receiving from the community, from the nurse, either by reporting or recording, so all this information, it can be planned, it can be controlled, and it can be kept in an organized manner. Nextly, it will help the information which you are gathering, it will help in productivity, it will help in predicting the resource requirements, and it will help in meaningful program evaluations. Nothing but, so simply if you are going and giving vaccination, for example, we are giving the polio, we have given the polio vaccine, we have given the BCG vaccine, so we have given anti-hepatitis vaccine, and we are giving different types of vaccines for the children as well as mothers as well as the adult in the community. So if you don't have any kind of proper information, means how many doses of the vaccine has been went outside, how many patients has received, and how many of them are safe from the particular disease, or how many number of the patients were affected even after the vaccination. So if you have proper data, then only you can have fruitful production, then only you will have fruitful production. So here, if you want to do a program, if you want to implement a program, if you want to evaluate a particular program, either to which extent the program was succeeded and to which extent the program was failed, you need to have the data, and the data is taken from the information systems in the community health. Nextly, we'll discuss what are all the steps that were involved in the management of information system in India. So here the design is very simple here. So mainly they're using 7 steps here. Firstly, the identification of information that has to be taken. For example, in a community, in a group of community, for example, you take any area which is affected with some kind of malarial diseases. So we are taking this particular community. So after taking this community, what we are doing, we are collecting the information. So what is the age group present, what is the average gender base that is present, and how many people are getting affected with the disease, how many females are getting affected, how many males are getting affected, and how many children are getting affected. You need to take all the data. So the data which is there in the community, it has to be identified and it has to be taken. Then you have to collect the information. So we are taking the information either by survey or door-to-door visiting, or through records and reports, and through other means of data collection. And actually, what are all the data that is collected, it has been classified. Means, for example, how many diabetic patients are there, how many hypertensive patients are there, how many other disabled persons are there. So you can take all the data, you can classify accordingly. So what is the age group, in which age group, in which comorbidity patient that disease is occurring more. So you have to take all those information and you have to classify it in a great manner. And nextly, you need to store the information. So the information which is collected, the information which is analyzed, the information which is classified, it has to be stored in a proper manner. So then only you can get the data whenever you require. So if it is not stored in according to the plan, again the data will be lost, and the survey which is conducted and the classification which is done or the grading which was done will be lost completely. Nextly, retrieval of data. So what is the information that you have collected? It was stored. So the stored data, it has to be retrieved back. So the stored data, it has to be retrieved. So you can take it a day after tomorrow, or you can take it after 1 year, or you can take the data after 10 years, depending upon the situation. So depending upon the situation, depending upon the analysis, and depending upon the need, we retrieve the data which was collected and which was stored in a proper manner. Nextly, we'll do analysis of data. So we'll do, means priority wise we'll do. And lastly, we'll use the data mainly for the decision making. Means, for example, if you take this COVID-19 situation, so our government or our country has come to a decision based on the based on the results that were coming from the other countries. Means, before India got affected, there are many other countries like Spain, Italy and China which were affected seriously from this COVID-19. So what they have done, they have taken the data and they have predicted predicted, and they have analyzed this so and so age group is mainly getting affected, and so age group can be kept safe. And if you are in isolation, means if you are in home quarantine or self quarantine, you can avoid the disease. If anybody is exposing, it is causing the lot of spread, and it is causing even the death to the particular person who is affected. So based on the information that is taken from different countries, based on the treatment modalities that were implemented in different countries, we have come to a conclusion, and we have taken the decision to keep a particular lockdown until the vaccination has come. So that's what this management information system will work. So I have gone to outer side, but if you relate it to the India, so any kind of local epidemic or pandemic, what they will do, they will collect the data, and they will collect the data, and they will form a decision making, then only they will implement it. So these are some of the steps that were involved in the management information system. Nothing but firstly they will identify the information that has to be taken, then they will collect the information, they will classify the information, they will store, they will retrieve, they will analysis, and they will use it for the decision making. Coming to the role of community health nurse in MIS. So what is the role of community health nurse in MIS means? Mainly the management information system, it is divided into 4 modules. So these modules are nothing but statistical information firstly, nextly billing, third one is patient information, and lastly community evaluation. So the community health nurse, as a assessor of the patient, means she is mingling with more and more compared to the other health personnel with the community patient. So she knows, she have the particular data regarding the health of the patient, regarding the health progress of the patient, because as she is a caregiver, she acts even also as a data collector, and she acts as a record keeper, and she acts as a service provider, and she also acts as a evaluator, because she is the one who always go and mingle with the patients in the community. She is the one who takes the data, she is the one who collect the data from the community. So she is the one who evaluates the data, means whether the care given to the community it has reached or not, whether it is meeting the needs of the community or not. Because of that, she has a vital role. So firstly we'll see the statistical information module. So this one we have 4, as I said, statistical information module, and we have billing module, and we have patient assessment module, and we have fourthly community evaluation. So in statistical information module we have again 2. So first one is visit information, and secondly patient information. So here if you see the visit information, it is focusing on the nurse, the information on each nursing activity, and it is entered into the daily activity sheet. So what is the nurse is doing, so whenever she is visiting the patient, so what kind of care she is giving, what are all the problems that she has observed, she will take everything. And actually the patient information, so here the patient information, it is mainly focusing on the data collected and entered into a report of service. So whether the service was given to the patient or not, whether he is feeling proper, means healthy or not, whether he has any kind of health issues or not, whether the service has given to him in a appropriate manner or not. So you will take everything. So it is mainly collected from each patient. So visit information is mainly taken from the nurse, from the daily activity sheet, and the patient information, it is collected from the report of service, means it is collected from each patient. So this module, it helps in the planning, it helps in staffing, it helps in budgeting, it helps in decision making activities of an agency. Because when a patient is not satisfied, or when a patient is having any other problem, so based on the problems that is taken from the patient, and based on the visit information that is there in the daily activity chart, so if any further planning is needed, they will do further planning. If any improvement in the staffing is needed, they will do improvement in staffing. And if there is any kind of financial issues are there, they will go for budgeting. And nextly they will see the decision making with this agency. Nextly, billing information module. So this one is nothing but it is mainly dealing with the financial data. So it improves the cash flow and supports the financial process and accounts in keeping. And lastly, not last, thirdly, we'll see the patient assessment module. So here the patient assessment module, so mainly it is helping us to know the clear data regarding the patient progress. So from the initial assessment to diagnosis, treatment, discharge, as well as post discharge and follow up. So this module, it uses the data that is generated by the problem oriented patient record. Means here it was regarding the problem which was given by the patient. The patient itself, he is having a problem, so he came to us. What we are doing, we are diagnosing, we are giving treatment, and we are following up it in the post discharge as well as during the discharge time. So mainly it relies on the definitions for carrying and coding interventions that are appropriate to the community nursing practice. Means nothing but, so it is mainly depending upon the coding interventions that are very appropriate to the community health nursing practice. So this is patient assessment module. And nextly we'll see what is the community health nursing service evaluation module. So this one is the last thing here. So here this module provides us the important health characteristics and health status indicators of the population, mainly for auditing, for evaluating, and for the quality nursing practice. So this evaluation module, so the word itself, the evaluation itself, you can say it is mainly collecting the data from the community, whether the services that are provided are up to the mark or not, whether the patient was satisfied or not, whether the health problem or the health issue in the community or in the individual or in the patient has retrieved or not. So we are taking everything in there. So it is also measuring the cost effectiveness and the equitable distribution of services and the long term and short term outcomes of these services. What it is doing, it is evaluating. Means there are lot of health programs that were implemented in the community. So whether those programs are having greater yield or not, whether they are distributed in an appropriate manner or not, whether they are cost effective or not, or whether they are becoming burden than the benefit. So they will take each and everything in this community health service module. So lastly we'll see what are all the uses of this management of information system. Here the management of information system means it requires only less number of people to prepare the financial information on billings and for patient services. So as the data is already collected and the data is already being maintained in the nurses records in the form of evolutionary module, in the form of billing information module, in the form of patient assessment module, or in the form of statistical information module. So the data, see here, that as the data is in an organized manner, so it requires a very less number of people at the time of billing as per the patient services, and it enhances the cash flow and it cut down the professional staff time. Means so there is no need of any other professional to sit down there and to collect the data or to interpret the data to do the decision making. So there is no need of any professional staff or any kind of paperwork, because of the management information system. Already the data was retrieved, the data was classified, it was well organized, it was analyzed, and it is used for the decision making. So it recognizes the significant trends in the utilization of health services. It helps in program planning as well as budgeting. It helps in testing the validity of ongoing programs. It identifies the new community needs. It evaluates the effects of nursing practice. So these are all the uses of MIS, Management Information System. Hope you understood. So in next class I'll discuss the maintenance of records and reports. So please follow the second part of this video. Thank you so much for watching, and if you like the content, please like, share and subscribe the channel, and if you have any queries you can drop them in the comment box. Thank you so much. Thanks for watching.